Grady osteopath, and today I want to explain to you a soft tissue manipulation for tennis elbow type symptoms or scar tissue around the common extensor origin, particularly of the tendons or the muscles of extensor carpi radialis longus and brevis up around the common extensor origin up here. So what I will do for this is I will support the patient's elbow with my Keflad hand here like that. I'll work from the lateral epicondyle and work medially and distally onto the CEO here like that. And what you're looking for is scar tissue here, and what you're trying to do is remodel the tissue and break down the scar tissue, I suppose, here like that on the elbow. With the caudad hand, what I'm doing is I'm taking just below the wrist, I'm grasping below the wrist because it's the extensors which I want to affect, which attach below the wrist onto the carpals in the wrist, etc., and the fingers. So I'm holding here. So I'm on the point of where I feel scar tissue. Just use your palpatory skills to find that, and the patient's face will normally tell you that you're on the right area. Okay, so I'm down here. So bring the shoulder into 90 degrees of abduction like that. Flex the elbow to 90 degrees. I'm in a staggered stance like that. The forearm is against my abdomen like that. And what I'm doing is I am winding up, so I'm bringing the palm into, bring the palm into a loose fist like that. I'm bringing the wrist into palm reflection like this, and a bit of pronation. And I'm testing the waters here and winding up to the point where it is tight. So I'm trying to stretch the muscles, and I'm trying to really, it's a soft tissue release, or almost a tearing at a microscopic level of the tissues between the lock and the insertion onto the lateral epicondyle. So winding, and it's a short, sharp pronation of the wrist. And with that, because it's quite a painful technique, you'll have to be careful of the dosage of it, depending on if the person has quite chronic tendinitis and it's very tender. You really want to be careful with this. You might only do it 4 or 5 times. Okay, so that's it. But that's dose dependent. It depends on what you're dealing with in front of you. So that, everybody, is a soft tissue manipulation for scar tissue on the common extensor origin. If you like the video, please subscribe. Talk to you next time.